Welcome to Simplified OASIS Q&A Part 2, your quick reference guide for all essential information and answers regarding OASIS visits. Navigating different OASIS scenarios can be overwhelming, but it doesn't have to be. Welcome to Part 2 of the 3-part series covering the most commonly asked questions when scheduling OASIS visits. Let's dive in. This video covers more frequently asked questions when scheduling OASIS visits. The start of care. The start of care is the date the first billable service is provided. Who performs the OASIS start of care when both RN and PT are ordered? When both RN and PT disciplines are ordered at start of care, the RN would perform the start of care comprehensive assessment. Either discipline may perform subsequent assessments. If nurse fails to perform start of care assessment because he or she has to send patient to the ER, what is done? If no billable service is provided before the patient is transported to the ER, the start of care was not established and a new start of care would be completed upon patient's return home from the inpatient facility. What date goes on MU90 for PT-only patient when RN in the office did the medication reconciliation the day after PT visit? Date assessment completed is the date that the last piece of information necessary to complete the comprehensive assessment is gathered. If your physical therapists rely on a nurse in the office to perform certain components of the drug regimen review, the date the RN in the office communicates her drug regimen findings back to the PT becomes the MU90 date, the date the assessment was completed. PT is ordered, but RN to enter at a later time during episode. If the RN's entry into the case is known at start of care, even if only for one visit, then the case is not therapy only, and the RN should conduct the start of care comprehensive assessment. If the order for the RN is not known at start of care and originates from a verbal or written order after start of care, then the case is therapy only at start of care, and the therapist can perform the start of care comprehensive assessment. How much time after referral do I have to complete the start of care or resumption of care? The initial assessment visit at start of care or the resumption of care assessment visit must be completed within 48 hours of the referral, within 48 hours of the patient's return home, or on the physician-ordered start of care resumption of care date. In the absence of a physician-ordered start of care or resumption of care date, or if the patient refuses a visit within this 48-hour period, the agency may contact the physician to determine whether a delay in visiting would be detrimental to the plan of care and request a change in the start of care resumption of care date. How much time after start of care do I have to complete the assessment? The start of care comprehensive assessment must be completed on or within 5 calendar days after the start of care date and in compliance with agency policies. What do I do when only one visit is performed at start of care? Completion of a comprehensive patient assessment is required, even when the patient only receives a single visit in an episode. But an OASIS data collection and submission is not required when only one visit is made in a quality episode. However, to bill Medicare for a single visit payment episode, OASIS data must be collected and submitted to the OASIS system for inclusion on the Medicare claim. If you choose not to bill Medicare for the single visit provided, there is no requirement to collect and transmit OASIS data for single visit episodes. Regardless of pay source, no discharge assessment is required as the patient received only one visit. Agency clinical documentation should note that no further visits occurred. PT-only patient, how do I go about medications? For therapy-only cases where the therapist is completing the comprehensive assessment, it is acceptable for an RN in the office to collaborate on the medication regimen review. If areas of concern are identified, the agency must notify the physician and, as appropriate, obtain orders, if any nursing intervention, to further assess and resolve issues and educate the patient regarding medication changes and management. Thanks for watching! For more videos like this, be sure to subscribe. If this video was helpful, hit the like button. It helps others find it too. For helpful downloadable digital resources on home health management, check out the links below. For questions and insights, drop a comment. And if you know someone who could benefit from this video, feel free to share. See you in the next one.